they know what they are doing about concerning that. If you ask me, it's not real.
I believe that COVID-19 is a game that our leaders want to use and eat money.
I think the whole thing is a scam. That is why I see it.
Oga, do you believe in COVID-19? If there is, let me touch you, let me get corona. There is nothing like COVID-19 in Nigeria. Even if there is in other countries, we don't have it.
Now, as one of our major challenges has to do with mistrust in government, and NCDC happens to be a government agency.
On February 27, 2020, the first coronavirus disease 2019 alias COVID-19 case was discovered in Nigeria from an Italian citizen. The individual had landed at Lagos airport from Italy and had subsequently traveled from Lagos to Ogun State. Since then, COVID-19 turned into a pandemic in Nigeria, likewise in other parts of the world. The Nigerian health system suffered severely as more and more individuals got infected. This led to the establishment of regulations to help control the spread, like social distancing, among others. Subsequently, this led to a lockdown in major parts of the country. During this period, there were speculations that the virus was created in a lab on purpose, and others stated that there was no such thing as COVID-19. Here, some Nigerians believe that the disease was not real, rather a propaganda used to create panic.
They know better. They know better. If there are cases like that, individuals we are living with, there should be one or two persons with that ailment. So that's a test of whatever that is happening. So they can manufacture numbers from the blues. So we should have an example of someone, if not close to our house, very close to the environment, who is suffering or who has suffered, or family that love their loved ones as a result of those diseases that have been mentioned.
Personally, we are just trying to be obedient to the government in the issue of COVID-19. We don't want to say that we disobey the government in power. If not, I want to say that there's nothing like COVID-19.
I think the whole thing is a scam. That is why I see it.
I call for investigation. I call for investigation of the huge amount of money that is being spent on issues of COVID-19, and let the federal government come and show us the victims.
It's false. It's not real. It's not real. Why would they tell Nigerians that we are not fool, we are not stupid? Now, Nigeria they have been educated and have been known for all what they have been doing to us for a very long time.
In the world at large, we see cases where people have been infected, people die, we hear stories. I won't give a chance to that. And the first thing I had to do is to find out if this vaccine is harmful, and since it's not harmful, I went ahead to have myself vaccinated.
All I can say is that we've been living our lives and nothing has happened, so personally, no. I don't believe it.
The doubt by Nigerians was one of the challenges faced by the Nigerian Center for Disease and Control. Rejoice Luka Lawal, a public health physician and the manager of the Incident Coordination Center in NCDC, had this to say.
Now, as one of our major challenges has to do with mistrust in government, and NCDC happens to be a government agency, and so that mistrust was there. So one of the hurdles we needed to go through and to overcome was gaining the trust of the Nigerians and the general public at the whole. And in NCDC, we established an emergency operations center, and in this emergency operations center, we have what we call the incident management system structure. And embedded in this management system structure is the risk communication and community engagement team.
As of the time of filing this report, the number of active cases in Nigeria stood at 3,467, and it was gathered that the cases are mostly asymptomatic cases. Rejoice explained the situation and also commented on the preparedness of the center if an outbreak occurs again.
But as the the virus evolved, we now knew that there are actually severe cases, moderate cases, mild cases, and even the asymptomatic cases. So majority now happens to over 80% are actually asymptomatic cases, with a few, very few now, that might be severe, that will require going to the isolation centers or treatment centers. So majority of the cases now are asymptomatic cases or mild cases. So most of them are on home-based care. So we now have what we call home-based care. So we use the home-based care facility for those that are asymptomatic cases and the mild cases. Over time, we have had a lot of training, and we have built capacities. For instance, at the onset of the COVID-19 pandemic, we had a challenge of having only 3 molecular laboratories that could diagnose COVID-19 in country. As the pandemic continues, we were able to build the network of molecular laboratories across the country with the help of the federal government, the state government, other organizations, private organizations, and other partners. We're able to increase this molecular laboratory to up to 150 laboratories across the country. Also, we were able to conduct a lot of training of our healthcare workforce. And so, training on IPC, training on digitalization of our surveillance system. So we now have a real-time surveillance system that we can easily get our data real-time. And we also have public health emergency operation centers, which is a physical structure where you coordinate all response activity in all the 33 states of the country at the same time, including FCT. So with advent of any outbreak, we have the capacity to coordinate from these centers, and we also have our diagnostic capacity. We can have real-time data, and that will also strengthen our ability to respond and detect and then prevent any outbreak should it occur in the near future.
Few days ago, the Presidential Steering Committee on COVID-19 relaxed the travel protocols. The main points noted from the advisory include no compulsory use of face masks or tests for pre- and post-arrival travelers. When asked about what pushed the motive and the risk of incoming travelers who may carry the virus, she said,
the Nigerian Center for Disease Control and as well provide to the Nigerian, that's the COVID-19 Steering Committee, recommendations in terms of relaxation of COVID-19 protocols and all of that. And the Nigerian Center for Disease Control is an evidence-based institution. So, and our evidence are based on our surveillance system and all the data we get per day across the 36 states and FCT. And from what we have currently and what the virus itself, what we currently know about the virus, especially with regards to its transmissibility, the number of cases we have currently, and over a time frame. At the same time, the virulence of most of those that come positive. Like I said earlier, most of the people that will currently have the active cases are actually asymptomatic cases or mild cases at the very high extent. So with all these informations in place, where is actually required for a relaxation of the protocols. So these were the deliberations that took place between NCDC, the steering committee, the Ministry of Aviation and the rest, and then this recommendation was made. So it's actually an evidence-based recommendation, and I think the government has taken the right step as well. There is still active surveillance at the point of entries, and even with currently we have other disease entities like the Ebola outside of the country, and we are proactively doing an intense surveillance. So we still have at our borders our ability to actually do immediate check and triaging of cases at those border entries. So even when they come without a pre-boarding test, they still get to the facility and they get checked. If they have any symptom that is in keeping with COVID-19 or even Ebola, their samples are still collected and they are still advised to isolate while the samples are tested.